You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Jenna Kokoski, a BCBA with over 20 years of experience in the ABA field. Jenna is the COO of Jade Health and experts in dedication to creating ethical and sustainable business models. She's here to talk about ensuring quality care in ABA, what families should look for in a provider, and how accreditation benefits both families and individuals with autism. Welcome to the podcast, Jenna Kokoski.
Yeah, thanks for having me. Happy to be here.
Well, we're happy to have you. And accreditation is a very big thing. And it's one of those things that as the industry of healthcare, especially with autistic services, has grown, is the protections for families become very important. But before we go there, you have found your path here in advocacy, ensuring quality, and there must be some passion that started that. I'd love to hear your backstory and understand what drove you to where you're at right now.
Yeah, so I really got started working with special needs, honestly, when I was, I think, in elementary school. My parents drove a bus on Sundays that would pick up people from an assisted living center and bring them to church. And I would always be on that bus and participate with that group. And I just instantly was like, this is where I'm supposed to be. I'm comfortable. I love it. And then I kind of just grew from there. I was able to work in, I think in undergrad, I worked in a special needs school. And that was my first experience with seeing a BCBA. Not understanding. That was really when it was still starting to become a field. And so getting to see what they were doing on a regular basis was really exciting to me. So I started as a special ed teacher, and then I was working on my BCBA while doing that. One thing that really pushed me towards opening my own business was when I would be sitting in an IEP and be telling all these families these great things that their kids doing at school, and we got them to do this and go to the bathroom by themselves and all these different things, and the parents would sit there and be like, wow, none of that happens at home. And that really got to me thinking, what I'm working on here is good and important and needs to happen, but I want to help affect the whole family and this child's whole life. And so that really pushed me to being like, okay, I want to go in home. That's where I want to be. So I started my own business, and we did in-home services for 7 years. And then we opened a clinic as well, but we served over 100-mile radius, just because the more people needed, the more we kind of followed, and it was a lot of organic growth, but really fitting the need that needed to happen. But yeah, that's pretty much how I got to owning my own business, and really much more at the operations level in advocating and working with families. That's what's really important to me. And so when an opportunity with Jade came up, that really piqued my interest, because I do see the accreditation. I see the value in it. When I was a business owner, I went through BHCOE accreditation myself, and I felt that it really helped me get things in place, things I didn't even know needed to be in place, put into place. And so that kind of really, like I said, when Jade came knocking, that made me think, okay, I have real life experience with this. And I think it was really impactful for me and my business and the clients that we served, but then also just like you were saying, where everything's going, just in the healthcare field in general, accreditation is going to be something in our field, whether we want it to be or not. And so the thought of having clinicians being the one putting this forward, I think is very important, because we are keeping that clinical quality as our number one metric. So yeah, that's pretty much how I got to Jade.
When I think of accreditation and just the inherent value of, go back to the fact that a lot of organizations especially smaller and growing organizations in healthcare, are clinician led, which means that they probably are really good at understanding the practice, the
Yeah.
implementation, the research behind what they're doing, the science. But running businesses and being able to operate a larger organization and have so many different managers working on so many different components of your business, that's a whole new
Yeah.
venture for a lot of people. So what is accreditation? I mean, you're not just looking at, does this person know how to do ABA? I mean, what is accreditation, and what is it that you're looking for that helps define quality in the delivery of care?
Yeah. So we have several domains within our standard set. So we're looking at ethics and integrity, essentially, general requirements like general liability, anything that is needed within any organization to have. We also then look at patient intake process, and that also goes into like their communications with the payers and the insurance side of things, and what does that look like? Are we following all the service delivery that should be done clinically that we know through ABA? And then as well as collaboration with other providers. So that's BCBA's collaborating with speech pathologists, with OTs, with whole child care. Are they actively participating in that process as well? And then there's the standard operational procedures, HR, even like the finance side of things. Are you setting yourself up to be here long term, so that we don't have another issue with access to care? So we are really diving into everything. It's not like we're just reviewing documentation and that's about it. We review and check to make sure that all staff are actually certified and up to date and don't have any issues with their certifications. Then we do surveys to parents and another survey to staff as well. And then, like we said, the documentation review. We do observations of clinical processes in place. So we observe an ABA session, and we have that kiddo's treatment plan, their assessments. We have everything to compare. Here's what's in writing. Is it actually happening in real life? Because that's where the important part comes in. And then we do a leadership interview that's both operational and clinical as well.
So it sounds like, I mean, through this entire process is that you're looking at, is it defined in practice, which oftentimes there's breakdown because you have so many layers of care. When I think of ABA, it's a very complicated model of care. Like when you think about it initially, it's like, oh, well, this is somebody going into a home and following a treatment plan, and then behind the scenes, somebody is billing for this and somebody is getting it authorized. But the actual nuances of how to make all that work, finding that everybody's meeting legislative requirements, industry standard requirements, is that something, how do you all tackle that? Because those things seem to be changing on almost a monthly basis right now. Every time you look at the news, there's something new coming up. So how does Jade make sure that they're enabling the organizations to maintain accreditation with constant changes that seem to be occurring in the field?
So that's where it comes in, that we are saying these are the practices that should be in place for best quality care. We are not going back and forth. Our standards are the standards, regardless of whatever else might be going on. There are some standards that might be specific to follow XYZ law in your state around, or your region, whatever that might be. But as far as the standards for like clinical care, operational, all of those, we're saying these are just best practices. That's where we're at regardless. And I'll dive in here really quick about the creation of the standards are done with a large group. Nobody within BHCOE is creating these standards. This is all an outside committee. We have about 20 people on this committee, and it changes out. So we have providers that are both accredited and not accredited organizations. We have payers that are involved, autistic individuals, advocates, parents. So we have a lot are all involved in the process of creating these standards. And that's why we're able to say, like, no, these are just best practice standards, regardless of what else might be going on in the world. Like, this is where the standard should be, which might be higher than what is expected in some states or by some payers. But luckily, we don't have to do that back and forth because we're just looking at what is the standard quality care.
And one would think that I shouldn't be applying a clinical standard differently across different states simply because of regulatory guidance. I mean, there are times where you have a premise of this is what good clinical care looks like, and this is what it should feel like for a family. That should be relatively standard. So what should be looking for when they're trying to find that quality provider, or when they're trying to go through and there's so many options out there, wither down, this is the 4 or 5 I want to talk to before I find the right choice for my family?
Mm-hmm. That's a very good question. And I think that you're right. There are so many options out there that it's like you're inundated with so much information and so many options out there. I think obviously one of the first things is, have they gone through something like an accreditation where they've put themselves through this process to have a validation check? Accreditation only lasts 2 years, so they have to reaccredit. So we're constantly making sure that the processes and everything is still in place. So obviously that's one of the first ones. I think that another thing is to look at how long have they been in business, and how long specifically their BCBAs have been. BCBA turnover rate is less than RVT turnover rate. So you expect RVTs to turn over regularly. Unfortunately, that's the way it is as of right now, until we can find the golden nugget to solve that problem. But I would look at BCBA turnover rate. How long have your clinicians been with the organization? I think also looking at, this is where it gets tricky, looking at complaints online. Most of the time, the people are going to be most vocal when they're upset. So taking that with a grain of salt, knowing that as well. I think also what's really important, I am a mother as well. And I think sometimes you just have to listen to your spidey senses, get in there, and you're also like interviewing that organization, and really take that mindset and listen to yourself. Your spidey senses will tell you, I'm uncomfortable, I'm not sure why, or I feel at peace. This is a good place and I'm not sure why. I think listen to those as well. But then realizing that, yeah, you're the one that is also interviewing them as well. So I think come to the table there ready to have all of those discussions and ask all of your questions. But I think being able to have a good bearing on understanding how long they've been in business, how long they've been providing clinical work, and how long really their BCBAs have been around.
That clinical expertise part is extremely important, and anybody who touches the clinical care of your child has that competency, has that understanding. You did hit on one piece that I think it's important to understand, is that technician level is one where there is higher turnover. So should families be asking about, I don't know, the training that goes for those individuals, how you're ensuring that they have the skill set before they're going into the field or before they see a child? How do you break that piece down? Because that seems important.
That is very important. And yeah, the turnover for that level, the technician level, is extremely high. I think ensuring that all of the techs are actually truly RBT certified and credentialed. RBT, they have to have the 40-hour coursework, pass an exam, and pass, a a rigorous check of making sure that they are able to show what they have learned through this 40-hour course. And then what does that process look like? It is vastly different. We see this is an area that we look at intensely through an accreditation process, and it can vary significantly. Some might be sure they sat down and watched 40 hours worth of videos, and then somebody signed off and they were able to pass a test. And then we have others that are, they are participating in a 40-hour course, but they're also then coming into clinic and they're having to show what they've just learned on that coursework, doing that in practice, having face-to-face time with BCBAs and with other RBTs, observing, participating, and then completing the competency and the assessment through there. The more times that a RBT is able to be direct, I think, with other staff and with other clients at the beginning, the better. I think the better outcome, and generally the longer term they're going to stay with the organization because they've already been able to have eyes on everything and really truly understand what they're stepping into. And so I think that's a great point. Definitely something that you want to look at. What does that process look like for a new hire at that level?
I think that when you're talking about this, it's obviously one of that many people are going to enter into is being a technician. And I do think empowering them the right way from the beginning, and for that to be a transparent process, not only for the employee, but also for the family, I think that that's really important. So the voice, you had talked about this earlier, and having numerous people involved in that process of establishing standards. It used to be that way. It used to be clinicians developed clinical standards, and that's what it was. The accreditation process seems to have broadened that, and rightfully so. How are you ensuring that there is a voice of the autistic community? How are you ensuring that and helping to determine this is really what we have valued, and these are the things that we care about to include in the standards? How's that process built out?
Yeah, so we are the only ANSI approved accrediting body for ABA, and ANSI stands for the American National Standards Institute. So they are essentially our accrediting body. So we're also going through all these checks and balances to ensure that the way our standards are being created is done ethically, done openly, and lots of voices involved in that process. And so, like I said, we have the whole gamut of stakeholders that are on our committee. And then also we have to go through, after that committee comes up with, okay, these are the standards that we all agree on, we have to go to open comment, which means we put it out publicly for 90 days. And this is where my job comes in, and this is where it gets heavy for me. Is to anybody can comment, anybody can ask questions about certain standards. They could say, I disagree with this standard because whatever that might be. And every one of those comments, every single one has to be taken into consideration, brought back to the committee, make adjustments as needed. Then it goes back to open comment again. So this process can take a very long time, but is very much needed. And I really think that that is the spot where autistic individuals need to be participating. Like we need them. We try to do our best to make sure that everybody knows when it's open for open comment, which is generally every 2 years. We do a review and then we have to open back up for comment. I think that is where we want to hear from families. That's how we know a lot of times about certain scenarios that might have come up for people that we might have not been privy to. Then we understand, oh, okay, yeah, there should be a standard around that type of situation that we weren't aware of. So that open comment time, I think, is really important for the greater community to participate in. And that's why I love that we are ANSI certified and we go through that long process. It's very long and tedious, but I think it's really important and needed. And it's really been an eye-opener for me as well, going through the process of realizing, oh yeah, I've never encountered that before. I didn't even think about that. Or especially situations that families have to encounter that us on the service delivery side might not have realized was causing issues as well.
Mm-hmm. And diligencing every aspect of a standard is so important, is that rushing into decision making,
Yeah.
whether that is, I mean, I think you're seeing it everywhere, is that rushing into things sometimes causes longer term pains versus sitting down, breaking it down, understanding all these components, because ultimately accreditation is guiding delivery of services. So when we're looking at who is benefiting from the accreditation system, I think through, families like you talked about. I think about the recipients of care being ones that should benefit. Providers, how is it that providers are benefiting? It isn't probably, I mean, it can't be is that I benefit simply by putting a stamp on my website saying I got certified. It's how is that ongoing relationship with a provider helping them to make sure that they're improving constantly?
Yeah. So for providers specifically, we have a few different areas. Like I said, accreditation lasts for 2 years. And within that 2 years, they are privy to a lot of different partnerships that we participate with other service providers as well. So that it will help their business. And then we have something that I love, and we have so many people participate in this. We call it peer mentorship clusters. And so this is really for leadership of any BHCOE accredited organizations can participate in these clusters where we try to get people that are in organizations roughly like the same level of position, and then also same size of organization. And then that's a great spot to come together and troubleshoot, learn new ways of doing things, ask all the questions. I'm lucky I get to be on some of the email threads of these, and I just read through and I'm like, oh, this is great information, or we need to get this part out to everybody. And so I think that really creating like a community of, hey, here's other people that are like-minded, other organizations that want to have this quality. And we're all kind of encountering and facing a lot of the same situations, and being able to have other people to troubleshoot some of those different areas as well. I mean, I think right now, as the field continues to evolve and payers evolve with requiring accreditation, which we're starting to see that to be a large uptick, is happening. That's going to be a natural benefit. If you are accredited, then you can actually credential with this payer. So that's going to be kind of, I believe, the next wave, but we're committed to making sure that we keep that community aspect. I think that that's really important, and that's where it's useful. It can be very lonely when you are kind of the leader of an organization. You're at that level where you're wearing all the hats, and so it's nice to be able to have other people that are in that same boat as you.
No, absolutely. We only know what we know and what we've experienced. And by having a larger room of people that can give some feedback and share their experience, ideally, we all are able to benefit from that. When we're talking about quality in autism care, is because you're talking about such a broad spectrum of needed service, and everybody who's coming to receive service is coming from a different position and a different vantage point. How are you looking? Is it more on I'm able to look at quality from a organizational, the structure is supporting quality viewpoint versus looking at a specific clinical outcome? What are the benchmarks that families would be looking at?
Great question. Through the evaluation for accreditation, that is much more structural and process based. So we're looking at what are the clinical structures you have in place, operational, what are your processes that your staff have to go through, process to intake families, or the reassessment time. So that's much more process based. We also have the National Autism Data Registry, and that is a clinical benchmarking program that really is achieving getting more of a national benchmark on autism services and the clinical outcomes that come with that. so that we can start to see and start to figure out, okay, this organization has, we call it an autism index score. So their score is 25, where this one over here is 57. And so which one would be better based on, that's really looking at the length of service and the clinical outcomes and improvements that have been done, that child has achieved through specific assessments, normed reference assessments. So, and that's being tracked on a quarterly basis. And we just don't, in our field, we don't have any type of benchmarking or standardized outcome measures that we're able to compare to different organizations, or even different ABA models. I'm really excited about that one. It's like so many other fields have these types of benchmarks, and it's something that we don't have. And I think this is going to be very important for families. To me, that will be an easier way of finding out the quality clinical care that's happening for a family to be able to come in. I think that'll make things easier for families to be able to see that number and understand where they are and make that decision for themselves.
Mm-hmm. And it's understandable to me in mental health, behavioral health, that it becomes harder to be able to get a lot of those data points because people are starting at very different points. They have different skill sets coming in. It's easier with a medical sort of diagnosis. Yes. But I would imagine over time, as we aggregate some of the data and we're able to get almost bifurcate it to the level of this particular child, this age, starting at this point, this is how this organization has performed historically with that. And maybe that's informing you as a business as well to say, this is what I'm really good at. This is where I need to work harder. But for a family, that data seems like it would be very important. Sounds like there's a big need still to get more data into the system. How is it that families can involve themselves in this, or can they?
We have had organizations come to us specifically for NADR because parents have asked them, or other clinicians, other BCBAs have asked and said, hey, what is your autism index score? And that's gotten, organizations like, oh, okay, I see people are interested. They do want to know what this is. So I think asking that question and just bringing it to their attention that this is something we care about, and we want to know more about. I really think that that's a great way to get involved there.
Not just on the involvement level, but also on contributing. It's, the more that you can pay it forward, you're going to help so many families in the future to be able to have more and more information to help guide their clinical journey and to be able to empower their child to be able to, live to whatever experiences they want to be able to be a part of. What advice do you have to families? Because if I were a parent right now, and I mean, just with social media and news and everything, I think that my head would spin trying to be able to navigate, what do I listen to? What do I not listen to? How do I know that this advertisement for a provider is legit? And how do I know that they're going to live up to things? What is your advice to families as they're starting to navigate the process after they have a diagnosis or a concern?
Yeah, you hit it spot on. I can only imagine how overwhelming it must be, especially if you Google and everything pops up. I think it's really important that you pay attention to more reputable advocacy groups. Most regions have good advocacy groups, whether it's like Midwest or even down to like county level. I think that's where you want to spend most of your time looking at, and not just everything that comes through on the internet. And I think that getting involved and participating in some of those things, I believe naturally will help you be able to understand and learn and kind of see the triggers that are important to you by being much more involved. I think also, like we said earlier, you're interviewing these organizations too. Don't take anything. They're marketing just like everybody else is marketing. And So you have to do your due diligence there.
I think that, what you're hitting on and just accreditation in general, I think gives a framework for families to start and to be able to look through the process and to understand what's going to be beneficial for them. And even to look at the unique factors of an organization to be able to understand what fits, what clicks with my family profile and how we want to process through treatment. So what would be that key takeaway that you're hoping for families to understand through the accreditation process or through some of the other materials that you might be offering for education purposes for families through Jade Health?
Absolutely. We have on our website a directory. So you can put in your zip code, your state, whatever, and it will tell you any accredited organizations and clinics that are in your area. So I think that that's first place you want to look. These are companies who have taken the time and spent the money to make sure that they are doing things correctly. We also have a Jade Learning Hub where we do have some parent content on there. I think it's always important to also look at what is the content that clinicians are receiving. And so we have it all on one website. And so we're able to, you can see what are clinicians being taught, what are clinicians learning, but then also what are some good parent training models. One thing that I think is really important is the concept of individualization. So when you are talking with an organization or you're looking through the clinical content of an organization, ensuring that your family's information and desires and what you guys want as an outcome is being taken into consideration significantly. There's no cookie cutter in ABA services, and there should not be. It should definitely be individualized, and you should be a participant in that process.
Mm-hmm. And the parent participation piece in behavioral health and applied behavior analysis specifically is a huge component. As much as you said that you combine the clinical material with the parent questions on your website, we're sometimes asking for families to understand that clinical material enough to participate in their home, maybe not as a clinician, but as a parent that is empowered to be able to support their child.
Yeah.
So I think that is super important for us to kind of make sure that information is out there for them. Where can they access the resources directly? What is the best way to be able to get in touch with you or with your organization?
Yeah, jadehealth.org. And then through there, you'll see a section about BHCOE, but then also the National Autism Data Registry as well. And also access to our learning management system that will be able to provide any type of learnings that could be useful for a family.
Well, Jenna, I appreciate you giving us time today, helping us to understand the process and to really start the conversation around accreditation so that everybody feels involved and that families know where to start looking and in navigating that process. So thanks for coming on, and hopefully as that data registry grows and we're able to kind of start to pull even more and more information out on that, we'd love to have you back again.
We'll have great conversation then.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.